Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, epilepsy is a very common problem. We get a lot of epilepsy patients. And what I feel personally is that for such a common clinical condition, there are
Yeah.
so many wrong thoughts and myths amongst the patients as well as the caregivers with respect to the disease, how to treat them, what the disease actually is. So I think this is a very good platform from where we can educate our patients as well as the caregivers as well as the patients, relatives, and friends, so that a lot of the wrong concepts and myths regarding epilepsy can be dealt with, and patients with epilepsy can be cared for in a much better way.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, we all know that our brain controls everything that we do, think, and everything. But how the brain actually controls everything is something that we hardly think of. To put it into context, the brain actually works by the basis of various electrical signals and networks within the brain on a much lower molecular or cellular level. So, once these electrical signals work abnormally, we tend to get a seizure. So, basically, a seizure is the manifestation of an abnormal electrical activity within the brain. The brain works by normal electrical activities. Whenever the activities that electrical activities inside the brain become abnormal, we end up getting what is called as a seizure.
What is epilepsy?
Okay. Epilepsy is the disease itself, while seizure is the manifestation that we get to see. So, whenever by definition, epilepsy is when a patient has two or more unprovoked seizures. So, what we highlight the term unprovoked, that means that the seizure is not caused by something else. Say, for instance, somebody has got an head injury or an infection in the brain and he has a seizure. That will not contribute or uh, be a part of the definition of what is known as epilepsy. For an epileptic seizure, it has to be an unprovoked one, and there has to be more than two such instances, and then only we can stamp one patient as a patient with epilepsy.
What are the different types of seizures and do they affect people differently?
Yes. So that is a very interesting and important question because traditionally people think of epilepsy as a disease that tends to have abnormal movements, jerkings of the whole body, of all four limbs. But it is not always so. Epilepsy is basically of two types. One is the focal type and another is the generalized type. As the name suggests, a generalized seizure means it will have manifestations involving all four limbs or both sides of the body. Might not always be the limbs. A patient might lose consciousness. That also falls under a generalized seizure. And it also might have movements of all the four limbs, which we
Yeah.
traditionally see and call epilepsy. Apart from this common notion, there can be what is called as focal epilepsy as well. In focal epilepsy, what happens is that there's abnormal activity in only one side of the brain. So, manifestations also tend to happen in one particular half of the body. There might be movements abnormal on one side of the body, and sometimes when the area of the brain that is abnormal, that does not control movement, then patients will have vague symptoms. Sometimes patients might become unresponsive, patient might have weird thoughts, weird behavior for a brief seconds or minutes. These also fall under what is known as focal epilepsy. So people need to be aware of the different manifestations that might occur and which might do end up in the purview of what is known as a seizure or ultimately as an epilepsy.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yes. So epilepsy, as I mentioned previously, epilepsy, there can be sometimes a definite cause which might cause the seizure or the epilepsy, like a head injury, an infection in the brain, a stroke. Sometimes in the elderly patients and patients who have dementia, they might also have seizures and end up developing what is called as epilepsy. But more often than not, there is not a definite precipitating or identifiable cause. That is a much commoner instance that we get in our day-to-day practice. And in such cases, there's a thought that this probably is due to genetic influences. Sometimes by various genetic tests, we can actually end up proving that there is some gene that is responsible for the epilepsy. But even sometimes, even with a battery of tests and investigations, we do not end up finding a definite cause for the epilepsy. In such a scenario where the cause sometimes might remain unidentified, it is very important that the patients are aware of what can be the symptoms, and the doctor and he or she consults the doctor quite early so that the disease can be treated and diagnosed at a very early stage.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yes. So, as I mentioned, epilepsy can be either generalized or focal. So, when it
Yeah.
is generalized, involving the movements of the body, patients have abnormal tonic or clonic movements of all the four limbs or one side of the body. That is what is traditionally recognized as epilepsy, but that is something which is quite easy to identify or understand. But it is important to note that many epilepsies do not usually have these traditional motor movements. Sometimes patients complain of blank, staring look, staring spells, where they might be unresponsive for brief seconds or minutes. There may be subtle manifestations like jerking of the limbs or some throwing away of objects, some brief durations of abnormal behavior. Sometimes the patient might have some weird thoughts, weird feelings, and might not respond as normal as he or she usually does to his or her environment. These all manifestations can be a part of the seizure depending on what part of the brain is involved.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes. So this is something that we face quite a lot. So the thing is, since our knowledge of epilepsy is growing day by day, previously say epilepsy has been there since ages, but the knowledge of epilepsy has evolved of late. So previously, since epileptic seizures can be very varied, as I just mentioned, epileptic seizures can be very fearful, can be very frightening for the observer. So, because of all of these facts and because of the lack of knowledge regarding what actually causes these abnormalities, there have been development of a lot of different concepts and myths over the years amongst the local people. So these have given rise to stigmatization, isolation of patients with epilepsy. Epilepsy is very commonly seen in children. So what is a big problem is that many children with epilepsy, they do not mingle with their peers, they do not play with their peers. Parents, they tend to keep them aside from their peers. Parents from their friends asks their children not to say interact with the people, with the children who are actually having epileptic events. They tend to have they tend to feel bad about it, and this becomes ultimately a vicious cycle. While they feel bad about interacting with others, people do not want their own friends and their children to not interact with people with epilepsy, and they do end up feeling more and more alone. So this is a big problem, and this should be addressed. That epilepsy is not something that is as scary as it always looks. It can be treated very easily with proper understanding of what it actually is and proper medical care.
How does this stigma affect people with epilepsy?
Yes, as I mentioned, that the
Yeah.
more stigma that they have to deal with, the more socially and emotionally they tend to get affected by it. And in today's age, where everybody is stressed, everybody is having a very busy, stressful life, so they would want that they to be having mental peace at their workplace or school or wherever. So the more that they tend to get isolated, the more they tend to get affected by it mentally. This ultimately affects their performance at every level. Say a children, he will have effect in his school performance, both academic as well as in his extracurricular activities. For adults as well, it will affect their job, their mental well-being at their workplace. Their economic influence will also be affected somewhat by, they will sometimes be taking leaves. Sometimes the bosses will not deal with them the way they will deal with somebody else, say, as so it affects different purposes in a mental, social, and in an economic way at all the levels of epilepsy patients.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yes. So, one of the most important things for managing epilepsy is to maintain a very healthy lifestyle. So, traditionally, as we all know, that having a good night's sleep, avoiding stress, avoiding certain addictions, having a peaceful life, having staying away from flickering lights, these are the various few triggers that can be easily avoided. So for all epilepsy patients, we tend to advise them to make sure that they lead a healthy lifestyle with a healthy diet. They avoid junk food. They make sure that they have a good night's sleep. Around 7 hours of sleep uninterrupted in the night is something that we recommend to all our epilepsy patients. Sleep deprivation is a very common trigger for epilepsy. Another thing is addictions. To stay away from smoking, alcohol as much as possible, because alcohol is a very potent trigger once again. Then again, sometimes there's something called as reflex epilepsy. So sometimes in these cases, flickering lights tend to be a trigger. We tend to ask them to stay away from flickering lights. So all in all, in short, maintaining a healthy diet, a healthy lifestyle with a good night's sleep and a peaceful, balanced work life will help you avoid the potential triggers for epilepsy.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. So there are simple things that we can all do to make sure that the injuries, which are a major concern for patients with epilepsy, are dealt with. So one thing that we can all do is make sure that the chances of fall and injury at home and at work are minimized by avoiding sharp edges. We can pad areas with sharp edges. We can make sure that the ground in the flooring in the ground in cases of patients with epilepsy are maintained as even as possible. We would ask our epilepsy patients to try and be careful in case of certain activities, like while cooking. They should always cook while in supervision of others, or certain small things changes, like instead of using the stove, if they can use the microwave. That is a much safer and easier option, where they're safe from the risks of injury, as well as they will feel more and more part of the society when they can do the work. So there are small steps, simple things that we all can think of and do, which can make sure that the chances of catastrophic complications of epilepsy are much less.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So, finally, I'd just like to mention that epilepsy is a very common condition. Firstly, epilepsy can present in a variety of ways. So, whatever symptoms that the patient might have, if you are having suspicion of epilepsy, do consult your doctor at the earliest. Over the years, the treatment of epilepsy has evolved quite a lot. With proper treatment, with maintenance of a few simple steps, patients with epilepsy can get a almost normal life. And thus, I think we need to deal with this disease together, and together we can definitely win our battle against epilepsy.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.